Next time you get pulled over, I dare you to ask the cop what his testosterone levels are. You'd probably be surprised by the answer. Obviously, don't do that. But there's a point here to this scenario, and let's check it out. But first, I'm Dr. Alex Watson, and I get people ready. In this case, I usually mean that I get people ready for cancer therapies, surgeries, any sort of performance-based thing like a fitness challenge, that sort of stuff. But I also have been working 7 days a week for about 3 months straight doing testosterone replacement for men. So I've learned a thing or two about testosterone done right and done wrong. The other piece is that my background's in physical medicine rehab, and I've worked a lot with first responders too. So I'm going to teach you everything I know about the effects of being a first responder on your testosterone levels. I've worked with police officers, FBI agents, firefighters, paramedics, EM physicians, basically anyone that you can think of who's a pretty tough guy who may actually have lower testosterone than you'd think. And there's a reason why. When they all started their jobs, they actually probably had higher testosterone levels than the average person. We do know that higher testosterone levels than average drive people to higher risk-taking jobs, as well as things like finance, but of course law enforcement's a big one, and faster-paced, medicine-type careers like emergency medicine or paramedics, that kind of stuff. So at baseline, these folks coming out of the academy, coming out of med school, coming out of wherever, typically going to have above average testosterone levels. However, for a number of reasons, by the time that they're more seasoned, research actually shows that their levels are below average, below their kind of recruit entry levels. And there's a number of reasons why, and they all kind of fall into the brain doesn't like stress and tries to throttle down testosterone and other metabolic processes when it feels a little stressed out. So the main reasons why this happens, kind of all, like I said, the stress different relationships here. So the main one being psychological stress, physical stress, all that kind of stuff. That's one factor, and I'll explain where this ties in anatomically soon. Then you have the shift work, sleep disturbance aspect of these things. So directly, of course, all these professions have some concept of shift work or frequent sleep disturbance. So if you're on call, that's going to certainly have a similar impact, whether you're on call for medicine or for firefighter calls, that kind of stuff. But also the sleep impact of more psychological stress. And that also kind of is its own factor here too. So PTSD and other aspects of anxiety disorders and those sorts of things, depression, burnout, all the things that are very common amongst those professionals, those are all going to also impact the same kind of pathways, almost there. And then finally, whether it be directly related to the stress, independent of that, we do know that substance use disorders, alcoholism, drugs, those sorts of things, do have a higher incidence and prevalence in first responders, medical professionals, that kind of thing. So all these different factors end up working to lower testosterone at the hypothalamic and pituitary levels. So your hypothalamus is always going to be checking out kind of your homeostasis. That's what it does. When it's looking and sees rising cortisol levels, so stress hormones, it's seeing that your sleep is becoming dysregulated, when you're flip-flopping between night and day, or you're having fragmented sleep, whatever it is, it's going to feed back on the pituitary to decrease production of a hormone called LH, luteinizing hormone. Luteinizing hormone is what tells the testes to produce testosterone. So all of those different stressors are going to then indirectly impact testosterone production. However, you also have a higher incidence of trauma to the testicular area there. So whether it be directly to the gonads or some structure connecting there, anything that is direct trauma or has the potential to change the temperature down there, all those things can also then cause a primary low testosterone issue. So a machinery issue below the belt, as I always say. So all those factors are going to feed into why we see much lower testosterone levels as someone is more seasoned and has kind of accumulated the battle scars and everything like that. How does low testosterone present? There's a reason why so many of my patients are going to score highly on depression screening tests, because it presents a lot like depression. I often see less of a true depression type, hopeless, helpless feeling, just dark, gloomy, and more of just a blah. Oftentimes low testosterone is going to just feel like there's just not a lot of spark. There's not a lot of low, necessarily. Of course there absolutely can be, but not typically. More of just a less motivation to do things, less enjoyment of life, and that's why those are actually common answers on the screening questionnaire, the Adam questionnaire. Then there's a more textbook specific kind of symptoms of erectile issues, libido issues, as well as loss of height. Lower bone density then causes a little bit of shrinking. And then some of the other elements of the Adam questionnaire there. So those are how it's going to present in all populations. In someone who's otherwise supposed to be kind of projecting this more macho side sort of thing, and they're just not feeling up to it, it may then present as just kind of grumpiness, frustration, those sorts of things, because they're low energy, they're expected to be high energy, and expected to be on their game. And that sort of kind of cognitive dissonance type thing is going to then result in someone being just kind of grumpy, burned out, that kind of stuff. So that's why I see a lot of first responders in my practice, and I treat them for low testosterone. It is miraculous just how much better someone feels, performs, all that stuff when you bring them up to a normal level. I'm not the guy who's going to take them up to the quadruple digits here in the thousands. That is often not necessary and counterproductive in terms of risk benefits, but bring someone from low to normal can still be a life-changing and beneficial thing. So if you think you are low, I would absolutely suggest talking to your doctor. If they, this is a different part, if they end up saying you're in the normal range, you're good, but you're at the very, very low end of the normal range, I would suggest finding a specialist who does this all day, every day. Thanks for watching. Please like this video so you can see other ones and other people can find this one if you found this helpful. Alrighty, take care.